Another example of cardiomyopathy is known as what? The Takotsubo Cardiomyopathy. And this Takotsubo Cardiomyopathy, we'll get to see a funny story behind this. You get to see why this concept is known as Takotsubo. And this concept is also known as what? Broken heart syndrome. Now, I'll take you guys to a picture. Can you see? Can you see this Japanese pot that is used in catching octopus? Is an octopus trap. Okay? So it's looking like a pot and all that. So they call this thing Takotsubo syndrome because what? They say that the heart actually looks like this. The heart actually looks like what? This octopus trap that Japanese use when there is a Takotsubo syndrome. Like when the person has a disease condition, probably if you do a chest x-ray or CT scan, you see the heart looking like the shape of this trap. Okay, so that's how the name was derived. We'll look at this condition from the characteristics, look at the symptoms, look at the diagnosis, look at the treatment and prognosis. So the Takotsubo cardiomyopathy, also known as broken heart syndrome, is a rare condition which is characterized by what? Sudden weakness of the heart muscles, ballooning of the left ventricle, resembling a Japanese octopus trap known as what? Takotsubo. So I've already spoken about it. Alright, it's a trap used in catching the octopus in the Japan. Alright, and my highest audience on my YouTube is even Japan. That's crazy. So this type of condition is often triggered by what? Intense emotional or physical stress. So that's why they call it what? A broken heart syndrome. Alright, when somebody's heartbroken for real, they can have this. Alright, maybe your girlfriend breaks up with you, maybe your boyfriend breaks up with you, you might have a broken heart syndrome, right? So looking at the symptoms, if somebody has this disease condition, how can they present in the clinic? They'll be having chest pain and discomfort, there'll be shortness of breath, there'll be dizziness or lightheadedness, there'll be fainting or palpitations. Alright, how can you be able to confirm your diagnosis? You do ECG or electrocardiogram, echocardiogram, cardiac catheterization, blood test, just to rule out other possible conditions that could result to this. Then treatment. Since the person is having difficulties in breathing and all those stuff, right? You might want to do supportive care such as what? Oxygen and pain management. Alright. They also give medications to manage their stress and heart function. Sometimes you might just give them medications to sleep, just to forget about their worries for the meantime. Okay. In some cases, angioplasty and stenting is needed. Prognosis. Most people recover within few weeks, right? So if it is a broken heart syndrome for real, then probably when you find a new girlfriend or your bestie is giving you vibes, then fine, you recover, all right? Then some may experience a long-term heart muscle weakness. Like let me say people who lost their partners, all right? You lost your partner and you're just angry with the whole world and all the stuff, right? Most of the times when you lose people, you just find new people, all right? So I think that's it for what the Takotsubo cardiomyopathy, also known as what broken heart syndrome. Characteristics, symptoms, diagnosis, treatment.